If any of the 7 things that I'm about to tell you are not true about the PT clinic that you're currently going to, it's time that you run, don't walk to a new clinic. Number 1, probably the most important thing, is that you receive one-on-one care when you're with them. Right there, we've pretty much eliminated most corporate-run clinics. For those of you who are on the patient side of things, it's not such a fun world for most PTs out there. Most PTs are stuck working with 2, 3, sometimes even 4 patients at a time, which means your overall care is really diluted. Basically, your PT clinic, it's like a clown car. You know, all these people, one, another one. Sometimes maybe even you had it where you and another patient are called back to the same PT at the same time. Probably didn't feel great. You probably left feeling like, man, I wish you would have spent a little more time with me. So if you're not even getting any one-on-one time at all, this is the biggest red flag. It's time to move along. Number 2, so maybe your clinic passed the first test and they see you one-on-one, but they only see you for like 10 or 15 minutes. What they do is they'll only see you for 10 or 15 minutes and then they throw you off to their tech, the assistant. And then you're gonna spend the rest of the next 30, 45 minutes, maybe longer, with this tech. The thing that they're gonna do is they're going to bill your insurance company saying that they worked with you one-on-one. So you're spending the money that you should be spending working with a doctor of physical therapy, spending it with somebody who's definitely not licensed to charge what they are. Question that you need to ask yourself is, am I really getting the best care if I'm actually only seeing the PT for 10 minutes, but then the rest of the time I'm spending it with somebody who has no real education? It's something to consider, and of course, like I said, it's so common now in PT that people just believe that that's how it should be. So those first 2 are really non-negotiable. If you're not getting seen one-on-one at all, and really if you're only getting seen one-on-one for about 10 or 15 minutes, it's time to start looking. Number 3 is my favorite, and that is just trying to remember what your home exercise program is supposed to be. Anyone who's been to PT before has gotten a home program. Maybe it's a beautiful 8.5 by 11 piece of paper with some pictures on it, or maybe it's just the PT telling you, hey, make sure you remember what we did today to do at home. You leave the clinic, they wipe their hands clean of you, and now you are left on your own to tackle the rest of your rehab outside of those clinic walls. I am a perfect example of somebody who forgets things really quick. You can ask my wife. She asked me to do something, and within 5 minutes, I've already forgotten what that task is. So if I walk into a clinic and I leave the clinic and I've been given exercises to do, just told what to do, good chance that by the time I go to do it in a day or 2, I'm gonna forget something. So number 3, really important, make sure that wherever you're going has a real clear-cut set of instructions of what to do for your home program. Number 4 is that the PT clinic that you go to is actually a publicly traded company. It means that they're on the stock exchange, which means that number 1 priority is to shareholders, not to you, the patient. This that we just talked about, especially number 1, number 2, is usually gonna go with this one, number 4. Number 5, the heaviest weight that they have in the gym is a 10-pound pink dumbbell. Now, this kind of place has its place, usually for 70-year-old grandmas and grandpas who really prefer to watch Family Feud over doing anything that involves using their body. Because in those cases, those people just really want to get out of pain. They don't really care about getting stronger. They just don't want their back to hurt. So they can have that. But if you're not that, if Family Feud isn't the highlight of your day and you'd actually rather go out and play sports or go lift heavy in the gym, go train for a marathon, you're probably going to need strength training that pushes you a little bit more than a 10-pound pink dumbbell will. So the next time you walk into this clinic, or you think back to the clinic that you went to, you think about what kind of equipment, what was the heaviest weight that they had in there. I can tell you, if they're serious about helping your performance, they're going to have equipment that actually allows you to strength train. Number 6, I can count this out. Number 6 is you spend at least 10 to 15 minutes doing fluff treatments, like sitting on a hot pack with E-stim or doing an ultrasound. Ultrasound, pretty much placebo. If anybody's doing an ultrasound at this point, they're just wasting your time. They're probably working with 2 or 3 other patients at the same time, and they need to buy a few minutes before they actually need to do something skilled with you. So they throw a tech to, hey, come do a little ultrasound on your back. I've never found a situation where the ultrasound is better than anything else that we can do, like manual therapy or exercise progressions. And then the old hot pack and stim thing. I personally don't use it because I think, hey, you can buy an eStim unit online for $30 and then you can do that at home. I'd rather spend my time doing skilled one-on-one things with you. You can do all that other stuff. You can sit on a hot pack at home while you're sitting there watching Netflix. Number 7, I probably saved the best, most important one for last, which is your PT is not listening to you. You feel like you talk to them and they just see you as an ankle injury, or they just see you as back pain. So what are we gonna do? Do the same thing we do with every patient with back pain. Funny story, I actually did a clinical at a place, I'm not gonna name it, but they had a piece of paper, because they were still doing paper charts, which is wild. But this piece of paper had the same exercise routine, same reps, same everything that they would do with any patient that was lower body. They had the same type thing for upper body too. So if you came in with a knee injury, or somebody else came in with a back injury, you would do those same exercises. It was crazy. That clinical really pissed me off, and it made me realize how bad PT can be, but it also made me realize how good I need to make PT for my patients to make sure that they never have an experience like they would have had there. So one of the most important things of getting results in PT is making sure that you have a good relationship with your PT, that they are listening to you, and that you feel like your goals, your needs, your concerns are being met there. Those are the 7 things that I believe make up a good practice, and that's exactly what I built mine around. I always treat people one-on-one. You're always going to spend time with me. Your home exercise program is going to be exactly spelled out for you in an app on your phone, because we're in 2025, not in 1974. I'm inside of a gym, so I made sure that we had all the heaviest equipment that we needed to make sure that you get to that top performance. And I just really care about being a healthcare practitioner who listens to you, because it just ticks me off so much when I go somewhere and I talk and they don't listen, and that's exactly what I wanted to avoid. So above all else, we're going to listen to you. We're going to craft a personalized plan, not some same list that that guy next to you is going to be getting. And I'm going to really get down in the trenches with you and make sure I go through that whole rehab process with you. One of the great added bonuses of working with me is that you're going to get 3 months of programming and support regardless of how many visits we do together. I know that most situations we're going to need at least that amount of time to see good lasting change, especially when it comes to strength. So I want to make sure that I'm right there with you and not just throwing you off to the wolves. Hey, go figure it out on your own. Go rely on YouTube videos like this. But hey, maybe you're somebody who really likes being jumbled with 3 or 4 other people. You like chaos. You like having to test your memory to see what exercises you remember from the session. And maybe you just really love a good old ultrasound, some hot packs, and some stim. And if that's what you like, hey, I'm all for it. Go do your thing. But if you know that you want something more, you care about your performance, you don't love sitting on the couch watching Family Feud, I know that I can offer you a better solution. If you want to learn a little bit more about what that solution looks like, make sure to hit that follow and check out other videos on the page. And if you want to learn a little bit more about how I can help your situation specifically, head to SUVAPTP.com, fill out the contact form, and I personally will reach out to you within a day. And I'll see you on the next video.